cardiovascular issues in Afghanistan. It's a great honor today to share insights from Afghanistan, a nation where decades of conflicts have not only reshaped lives, but have also profoundly impacted the cardiovascular data. Despite the limited resources and fragile infrastructures, Afghanistan cardiologists and healthcare workers continue to confront a growing epidemic of heart disease with resilience and innovation. Today's representation, I will highlight the actual burden of cardiovascular disease in conflict setting, explores the unique challenges faced by healthcare providers, and outline practical context-specific solutions that are emerging within Afghanistan evolving health system. Let's begin with the background. Here I will highlight the profound and lasting impact of more than 4 decades of continuous conflict on Afghanistan healthcare system, and especially in cardiovascular health. Over 40 years of war and instability have left our healthcare infrastructure fragile and underdeveloped. Healthcare infrastructures were destroyed, medical education was interrupted, and thousands of healthcare professionals fled. Today, we face a severe shortage of trained staff, only about 2.5 physicians per 10,000 people. The number of cardiologists, particularly female cardiologists, in such a traditional countries remains extremely limited, reflecting cultural and education barriers that persist. However, the CVD burden is enormous, yet there is still no unified national strategy in Afghanistan. Afghanistan also has no national health insurance system. In 2019, individuals spent about $224 United States dollars out of pocket on health system, while the income for each Afghan annually is about $355. This means most Afghans cannot afford proper medical care. Our rugged geography, population displacement, low public awareness regarding cardiovascular disease, and cultural constraints create additional barriers, all contributing to the rising burden of cardiovascular disease in the country. Conflict-related stress, disrupted continuity of care, and a lack of preventive service have all contributed to these trends. These facts remind us that improving cardiovascular health in Afghanistan is not only a medical mission, but also a social and humanitarian challenge. Now, let's look to the burden of cardiovascular disease. Non-communicable disease, especially cardiovascular disease, diabetes, cancer, and chronic lung condition, now causes 43% of all deaths in Afghanistan, marking a clear shift from infection to chronic illness. Among them, cardiovascular disease is a #1 killer in this country, taking more than 40,000 Afghan lives every year and placing our nation among those with the highest global heart disease mortality rates. If these trends continue, unfortunately, by 2030, over 60% of all deaths will be due to non-communicable disease, with women disproportionately affected. As the pie chart shows, heart disease now dominates all causes of death, surpassing infection and injured combined. In summary, Afghanistan is facing silent but fast-growing cardiovascular epidemics, one that urgently calls for national commitment and international partnership to save lives and secure a healthier future. The cardiovascular mortality rates in Afghanistan. in this graph shows the cardiovascular mortality trends in Afghanistan from 1990 to 2025. As you can see, the numbers have risen dramatically from around 175 deaths per 100,000 in 1990 to over 370 per 100,000 people in 2025. That means the death rate has more than doubled in just 35 years. This alarming increases reflect both the epidemiological transition and the long-term impact of conflict on healthcare delivery and prevention. When we compare Afghanistan in this pie chart to the other countries on the North Africa and Middle East, it was named, we find that Afghanistan and Egypt records the highest cardiovascular mortality rates, well above the regional average. It was above the regional average. The reason lies partly in the conflict's impact, particularly in our country. Countries with history of war or instability consistently show higher rates of death, disability, and disease burden. As ongoing insecurity disrupts care, limits access to health service and increases psychosocial stress that directly increases the burden of cardiovascular disease. Finally, despite a decline in regional daily rates, Afghanistan continues to face an absolute rise of cardiovascular deaths, meaning that more people are dying even a regional average improves. This widening gap highlights how fragile system and prolonged conflict amplify the human cost of cardiovascular disease. Here in this slide, you can see the most common cardiovascular problems or disease in Afghanistan. However, in Afghanistan, the broad spectrum of cardiovascular disease are prevalent. The major cardiovascular condition contributing to mortality in Afghanistan, hypertension ranks fourth globally with a rate of 66 deaths per 100,000, while coronary artery disease ranks sixth, causing over 40,000 deaths in 2020 alone. A staggering tool for a low resource setting. Here you can see the graph. Rheumatic heart disease remains widespread, particularly among women in rural areas of Afghanistan. Primarily, this problem is caused by the high prevalence of gas infection or group A streptococcal infection that's most common in Afghanistan. Patients often present at the advanced stage of rheumatic heart disease and struggle with the financial burden of treatment. Unfortunately, many of them who experiences severe symptoms without being diagnosed and treated are also compelled to conceive and unfortunately bear the children on this worse situation. Meanwhile, congenital heart disease patterns differs from those in Western countries, influenced by genetic, maternal, and cultural factors. Now we face with the storm of congenital heart disease in Afghanistan, and just a few centers are capable of diagnosis and managing and operating the congenital heart disease in Afghanistan. We also see growing challenges from heart failure, cardiomyopathies, and dysrhythmias, often linked to delayed diagnosis and limited access to specialized care. Even sometimes the very simple cases like hypertension, valvular heart disease, due to the lack of diagnostic facilities and unaffordability to cardiac services, they presented with heart failure. Cerebrovascular disease has further burden on already fragile system. Across all of these, the key challenges remain the same: high incidence of cardiovascular disease, a shortage of trained cardiologists, limited access to advanced cardiac service, and a late presentation of patients, all of which worsen outcomes and mortality. We have a healthcare system that's under strain. The barriers to cardiovascular care in Afghanistan are multifaceted. At the healthcare system level, the country faces an acute shortage of cardiologists, only 0.2 per 100 population. It's very small, along with inadequate facilities and limited diagnostic equipment, making care delivery extremely difficult. In 2008, we just had one female cardiologist in the country. Meanwhile, the country is very traditional and we have lots of cultural constraints for female patients to present to the male doctor. At the patient level, low public awareness about cardiovascular disease leads to late presentation, and nearly 70% of patients arrive only when complications have developed. In addition, financial hardship is a major obstacle, with 87% of patients paying out of pocket. And cultural barriers further limits access, especially for women. Socioeconomic and epidemiological challenges compound this crisis. Poverty, displacement, and double the burden of infection, disease, and non-communicable disease stretch the system behind. And finally, the conflict impacts cannot be ignored. Countries with prolonged conflict, including Afghanistan, show over 40% higher cardiovascular mortality, while 1 in 5 Afghans suffer from mental health conditions that further worsen cardiovascular outcomes. Together, these challenges illustrate that the problem is not only medical, it's systemic, social, and structural. The development of cardiology in Afghanistan returned back to 1970. On that time, while there was stability and security, complex cardiac procedures were performed in Kabul. Even the very big surgeries like valve replacement was performed in 1970 in Kabul governmental hospitals. Post-1980, after Soviet invasion and war, severely the health sector of Afghanistan, particularly in cardiology, severely disrupted, and medical services and infrastructure were destroyed. In 1980 to 2001, the ensuing civil war further devastated the country. Healthcare infrastructures and setting back decades of medical progress. After 2000, particularly in 2005, cardiovascular medicine in Afghanistan experienced significant advancement, and with the establishment of private hospitals, a new era of development in Afghanistan cardiovascular medicine was born. Now in some centers in Kabul and provinces, cardiovascular practices performed, and also in the same times, these centers are training center for Afghan doctors. In this challenging context, the Afghanistan Cardiovascular Association, this is the only association that coordinates the Afghan doctors and was established in 2014, has made notable progresses and achieved significant milestone in advancing cardiovascular health service. Since launching its Preventing Cardiology initiatives in 2009, ECE has significantly expanded its impact on reducing cardiovascular disease in the country. Between 2022 and 2023, in just 1 year, we recorded over 238,000 outpatient visits across the 7 hospitals nationwide, reflecting that the trust and growing access to cardiovascular care in Afghanistan. Our service span the full spectrum of cardiology from non-invasive procedures to invasive procedures like angiography, angioplasty, and also electrophysiology, studying device closures, cardiac surgery. We perform the different types of cardiac surgeries like CABG because we have the high prevalence of coronary artery disease. Most of them, or multivessel disease, needs CABG. And also there's a storm of rheumatic heart disease, so that we perform valve replacement and repair. And also vascular surgery is feasible now in the country. Operations which are now routinely available in Kabul in major provinces, but unfortunately, these services are still inadequate and disproportionate to the load of the cardiovascular patient in the country, and is unaffordable for most of Afghan people due to the economical problems and unaffordability to pay the fees. All of this has been made possible through a network of these activities are feasible through a network of modern facilities and dedicated team Afghan specialists who continue to deliver life-saving care under a challenging condition. Despite this very critical condition, the urgent needs for specialized cardiac care in Afghanistan needs more professional cardiologists. The limited number of specialists is overburdened with an enormous patient's load, which unfortunately compromises the standard of provided healthcare, particularly in cardiology. There was a notable shortage of cardiologists, particularly female cardiologists, in such a traditional and very restricted cultural country. The EC Directing Board has developed community-based curriculum for conducting cardiology trainings, starting from basics of cardiology like ECG, echocardiography, and basics of cardiology to interventional cardiology and cardiac surgery. Consequently, and fortunately, a vast number of doctors and healthcare professionals, particularly women, have received cardiology training, serving as the primary source of essential human resource for delivering cardiovascular medical service in Afghanistan. Here you can see that there's the training of cardiology in one of the state of the heart center, that's Arena Medical Complex in Afghanistan. And also we conducting different trainings, particularly the basic life support and advanced cardiac life support in different provinces of Afghanistan, and thousands of medical staffs were trained due to these activities. As the research and academic initiatives are crucial for addressing the Afghanistan cardiovascular challenges, our team has been actively engaged in publishing scientific work in leading international journals, including the Circulation Journal of American Heart Association and the Springer Nature and other very famous journals. Multiple international, and also we publish some articles and manuscripts in multiple international Congress abstract books. One of our landmark publication featured in Circulation, titled Global Rounds Afghanistan, a critical overview of cardiovascular medicine. In this article, we provide the world's first comprehensive insight into Afghanistan cardiovascular crisis and health system challenges. We have also established research collaboration with global institutions, translated international medical books in national language, and also we develop curricula for cardiology in order to train further cardiologists in Afghanistan. And also, in addition, EC members published books in national language. Through this initiative, the EC is helping bridge the gap between research, clinical practice, and public education in Afghanistan. As the fight against cardiovascular disease in Afghanistan requires both national and international collaboration, the Afghanistan Cardiovascular Association has actively sought to establish partnership with the leading international organization to strengthen its role within the global cardiology community. In 2022, we got the membership of World Heart Federation, recognizing our commitment to global cardiovascular health. In 2025, our membership in the Asia Pacific Society of Cardiology was officially ratified, placing Afghanistan among the leading societies in Asia Pacific regions. And eventually, in 2025, the EC was recognized as a global partner of the European Society of Cardiology. Together, these milestones mark Afghanistan integration into the global cardiology community, a symbol of progress, resilience, and shared dedication to advancing heart health, even in the face of decades of challenges. And if we conclude, in order to reduce the burden of cardiovascular disease and battle against the cardiovascular problems in Afghanistan, we design a strategic plan. Key recommendation to address cardiovascular disease in Afghanistan. You can see in this slide the 6 strategic pillars framework and a roadmap for addressing Afghanistan growing cardiovascular crisis. Our immediate actions within 2 years focus on designing a national strategic plan that unfortunately we have not yet this plan to address cardiovascular disease in Afghanistan in coordinating our initiatives through Afghanistan Cardiovascular Association. Our other plan is to rebuilding the infrastructure and workforce, increasing cardiologist density from 0.2 to 1 per 10,000 and train more female cardiologists in Afghanistan. To achieve this goal, we need the support of regional and international colleagues, particularly the Asian colleagues that are close to Afghanistan, and affordability is very easier for us than European and American countries. At the same time, implementing universal health insurance would eliminate nearly 87% of out-of-pocket costs, protecting vulnerable female Afghans, and make the cardiovascular health service affordable and feasible for each Afghan. In the medium terms, in 5 years, we proposed the national preventing strategy to launch population-wide screening and reducing late presentation by nearly 70%, because this is one of the big problems in Afghanistan, that most patients presented in late stage. Through international partnership, we aim to strengthen capacity building and establish telemedicine networks and other technical facilities to support Afghan cardiovascular health patients. In the long term, in 5-10 years, integrating mental...
We reached the time limit. Is that all right? So you can
it's the last slide.
Yeah,
it's the last slide. Yeah. And in conclusion, dear colleagues, the history of Afghanistan cardiovascular crisis is not just about disease. It's about resilience, determination, and the enduring hope of its people. Despite decades of conflicts, Afghan doctors, nurses, and young trainees continue to fight every heartbeat, often with limited tools and timeless dedication. Addressing cardiovascular in Afghanistan presents a significant challenge. The success of this humanitarian mission, which will profoundly affect the lives of millions of Afghans, requires urgent and coordinated collaboration between national and international stakeholders. Thank you for your time and attention.